with COVID-19. Social distancing, closed schools and businesses. Join Tim Seaman now for a live discussion with experts on finding direction through the crisis. Coronavirus, navigating change.
And good evening. Thanks for joining us this evening for this special KCAU-9 Town Hall Coronavirus Navigating Change. I'm Tim Seaman. From school closings to restaurants changing the way that they serve food, the COVID-19 outbreak is indeed impacting just about every area of our daily life here in Siouxland. Our goal tonight, though, is to help clear the haze surrounding some of the uncertainty that we're all facing. Leaders representing our city, our schools, and the county emergency management team all join me in studio tonight to help us sort through this information. But first, we want to take time to look at the recent numbers out just today involving coronavirus. In the United States and the tri-state area both. Here nationally today, more than 53,000 cases have been reported, and there have been more than 500 deaths across our nation. Locally, those cases, though, are much fewer. Nebraska confirming 61 cases through today, and South Dakota with just 30 positive test results. Here in Iowa, now reporting 124 positive COVID-19 cases. 2 have been confirmed here in Woodbury County, with a single case so far reported in Sioux County. And I want to take time now to introduce you to the folks that have taken time out of their very busy days to join us for this next half hour as we talk about navigating change here in our community. Closest to me, right to the left, Rebecca Socknet. She is the emergency manager with Woodbury County Emergency Management. Sioux City City Manager Bob Padmore is in the middle seat this evening, and Sioux City Community School District Superintendent Dr. Paul Gosman also joins us, and he is at the end of our panel this evening. Again, I just want to say thank you for taking time to address concerns folks have as we try to navigate change. There's no doubt about that. Rebecca, I want to start with you, because this, I know from your position, this is something that you didn't start planning for when you knew there was a case of COVID-19 in Seattle, Washington, or in California. This is part of what you do on a daily basis. So I just explain to people when the broad-based preparation started locally.
So honestly, as part of emergency management is planning for an all-hazards, multi-jurisdictional approach. So that really covers pretty much anything that could happen. So as soon as we started seeing cases, even as far away as China, we started looking at those, talking about it through our emergency management team, and just starting those initial discussions. And then as it, hit the states, and then the first few cases of Iowa is when we really started ramping up. We're having daily meetings and trying to keep that social distancing aspect as part of that, but knowing that it is an essential service that we are providing by coordinating resources and making sure all the pieces are where they need to be.
Communication in this time is so important. It's vital, in fact, and I know that communication goes to both the schools and the city as well. Bob, from the city standpoint, again, this isn't something that just started. I want both of you to just address that as well. Sure. It's an ongoing plan, obviously.
Yeah, we're very active with the Emergency Operations Center. Both Jeff Hansen, our planning manager, as well as our police and fire chief, are very active in that. They attend those meetings. What they hear, they pass back on to the city, so that the city and our city leaders, city council, can then act accordingly. In this case, we're taking our lead from the Emergency Operations Center and the Siouxland District Health as far as actions we need to take, and appreciate all they've done to keep us kind of out in front as much as they can on a daily basis of what we need to be doing.
Yeah, and in the school district, we've been watching this for some time. We began by putting some restrictions in place to keep the public out of our buildings, but ultimately had to close our schools on March 16. We're taking our direction from the same sources as have been mentioned, plus the governor's office. It's very important to us. We have 15,000 students, 2,400 staff members, and so, we're doing all that we can to communicate with them through our phone system, our text system, email system, and then, of course, even social media and great partners like you in the media, so that we're getting the most accurate data and information out there. There's been so much emotion surrounding this COVID-19, and that emotion's important, but we want to make certain we're making decisions and taking actions based on the information that's given to us by the experts.
And we will pass along several different pieces of resource information during the next half an hour. You'll be able to take those down or watch them again as they get posted to SiouxlandProud.com, but important links that you can use at home to help manage your daily lives. Dr. Gosman, I want to go back to you one more time here as we get started. There's a concern that the younger population is not always taking the risk as serious as maybe they should. You perhaps have hands-on with young people in our community more than anyone else. Do you get a sense that they're getting it, or do parents need to continue to enforce that?
Oh, I think they're getting it now. I think, you know, in the last week or so, as this thing has grown exponentially and our reactions have grown, I think they're certainly understanding it now, and it is very serious. And you know, we've seen on some early releases that the illness may not impact the young quite as much as some who are older, but they carry it and can create troubles, you know, by proximity, which is why I think that social distancing that was mentioned by Rebecca is so, you know, very important. And we've been working with our staff to stay in touch with our students, even though they're not in the same building, so that they can talk about these challenges and these changes, and even to try and keep some educational processes going forward.
We talk about people slowly getting it. That is indeed the case across the community, as in recent weeks, of course, restaurants and bars and so many other businesses have been closed. One of the questions we posed to our viewers throughout the last week or so involved the eating habits of our community, as everybody knows how much that has changed. These numbers probably won't shock you, but I think folks are getting this as well, as 90% of the people that replied to our poll, several hundred folks there, saying that indeed they're eating at home more often than they used to. We have a society that likes to go out and eat. There's no doubt about that. Mr. Padmore, I want to have you update us on some recent changes here just inside the city. Of course, the city hall room hours and the offices and whatnot are being handled differently, trying to stay at a distance, and I know just today some transportation changes as well.
Yeah, just to encourage social distancing as well as to protect our own employees, we have closed all our public buildings to the public. However, we're not closed for business. We are open. We're making accommodations for our utility billing customers. We're waiving late fees. We're not turning water off during this period of time. That being said, we have multiple ways that you can still contact the city. Through our information line, if you want to pay utilities, we still have the online option. We have drop boxes at all our grocery stores as well as in front of City Hall. And then ultimately, you can call our customer service number and pay your bill, or any questions you have for the city, we'll get it to the right spot. I'd like to give that number out. It's 279-6132. If you have an after-hours emergency related to your water or sewer utility, 279-6150, and we will get the appropriate staff to help you.
What about transportation needs? Busing, of course, inside the city, and transportation outside the city at Bud Day Field.
Yeah, our buses are still running. We've made some accommodation to, once again, the social distancing. We've moved fare boxes to the back door of the bus to help allow people to spread out. We encourage, you know, not sharing rows, but to spread out. We have seen a reduction in the number of riders, which has helped. At the airport, we're kind of at the whim of American Airlines. They've canceled flights due to numbers. People aren't flying right now, so the numbers flying in and out of Sioux City is reflected in the flights that are available.
Rebecca, I want to come back to you then. There's been discussion. We've been very lucky here in that we have 3 cases in our specific Siouxland area that involves Sioux City. Other cases, of course, in Madison County and Nebraska and South Dakota. But we've been lucky in that we haven't seen that huge spike. Are you beginning to sense that we may be flattening that curve just a little bit?
And part of that is, too, as we do more testing and get the resources available, we are going to see an increase in that numbers, because if you're not doing a lot of testing, you don't know that it's there. So even a lot of times, if some symptoms are coinciding with the COVID-19, you know, people are taking that self-responsibility and self-isolating, and, you know, employers are looking at it more, so asking them to stay home as well, and taking those precautions again, like Bob said, you know, making sure that it's not just affecting the employees, but then the people that we service as well.
Do you talk at all in your meetings about, we've read nationally that obviously in large cities in New York or Los Angeles, their tactics are a little different than what we have in our small community, but is there a chance that we may look at using dormitories or something as a place if we do see that big spike and we need to try to protect our hospital rooms and keep people with fevers perhaps at a different location? Is that something that's in the discussion?
And there's a lot of different agencies are making different accommodations and working through their individual agency plans. We do a lot of discussions, like I said, daily throughout the emergency management team, and with a few key players that come in, like District Health and the hospitals, Siouxland Community Health Center. So we have a variety of options, and that's part of, we plan for a couple different scenarios, but then we also know that those plans need to change. And as much as the governor's information is changing on a daily basis, so is ours.
Dr. Gosman, I want to go back to you. The schools are in the middle of this 4-week close down that was implemented. When do you think you'll know whether that will be sufficient or if the school year will be canceled? And I know that's a hypothetical, but give us an opinion, an idea of how you're thinking.
Right now we're planning on reopening on April 14th, which is the end of our what would have been normal spring break.
Sure. Yep.
And so we are making all of the plans and working with our staff members who are still being paid to do this work and to open up again. I don't know that anyone would be shocked if it were extended, but we're getting our information from the governor's office and the Department of Education here in Iowa. They've been very responsive. They give us communications constantly, and we're thankful for those. And so we'll continue to watch and see what they recommend. In the meantime, we're doing what we can to serve our students with a meal program that we've put in place in 24 different locations. It's been open for 4 days. We've served over 13,000 meals in those 4 days. We've made resources available on the website so that some learning activity can continue at home. It's not mandated, it's not required, but it does give that option. And we want our staff to stay in touch with our students and parents and families as best as they can during this time.
The meals program that's being offered, we just saw some video from some of those meals that have been dispersed.
Sure.
That, I am guessing, helps play a part in, we talk about the summer slide when kids are out of school in the summer. Programs like the food programs, guidance online from a particular teacher from time to time. Are those things going to help us avoid a slide now?
They really do make a difference, and so we encourage our families to stay in touch. We actually just learned of a grant that we received today. We applied quickly for it so that we could put some reading materials in the lunch and breakfast meals that we're handing out to students. We certainly have those resources available that are online, and we serve about 1,500 meals a day in the summer when we have the summer meal program, but as I indicated, we're serving in excess of 4,000 meals a day now. So obviously there's a great need there, and it's in 24 different locations. Not all of them are schools. Some are city parks and other locations where food insecurity is most great in our community.
Go ahead, Rebecca.
It's been really great too. We had very short notice with the closure of schools, so then being able to reach out, that was one key priority when we found that out as the team, was to make sure, the school-age kids were still getting fed, and there wasn't a lot of time for parents to make adjustments. And so a lot of other schools, not only within Woodbury County, but in the region, have done a variety of different things, applied for different grants if they were not eligible for certain ones, or otherwise, utilizing churches and doing not maybe daily, but maybe a week-long backpack. So there's a
and I think our own food bank has stepped forward as well. I know of a couple of our locations where they're coming in to provide food for, our food program is for children ages 1 to 18. They don't have to be our students, they can be any students, but the food bank's able to offer some food to adults in a drive-through manner, very safe. And when the kids come to our locations, they can pick up a breakfast and a lunch each day. The food bank, where they have their locations, they can also pick up meals as adults driving through their lines as well.
A couple of other quick education-based questions. I want to ask you about, again, it's a hypothetical, but a question I hear a lot is, what's going to happen to the senior class? Have you started to think about graduations? I mean, obviously you have. But
and I just want to say how much I feel for the class of 2020. We all remember high school, some of us very positively, some of us maybe not quite as positively in certain things, but there were those items that were rites of passage in your senior year, often in the spring of your senior year, and our seniors are having those disrupted right now, and even if we start back on April 14th, there will be some level of disruption there, and then I certainly know that some think this could continue even longer than that. We are discovering ways in which we can stay in touch with them using the electronic systems we have, and investigating ways that we can make their last semester, even if it stays with some social distancing, still positive. And and we can appropriately celebrate their success and the work that they've done in this district.
Education was one of the things we asked our viewers to comment on, and we've got poll results there as well from how they've responded to that question concerning the young people at home and staying educated. The question was, are you continuing your child's education at home? Unfortunately, the greater percentage there say no, and mom and dad may still be working and not able to do that,
right.
But we know kids are being contacted in other ways.
Yeah, and we are a one-to-one district, meaning that we have a device for every student in grades 6 through 12, and so we know that students have devices that they can use, but we also know our community has some challenges with internet connectivity in certain locations, and so we do hope that our parents and guardians of children out there will find a way to get to our website and see the resources that are there. They will have those conversations via the telephone with staff members when our staff members reach out to them to find ways to continue that educational process for at least this first period of time.
And on the screen now, some free learning apps that are posted on the school district website as well on our website for those grade-specific breakdowns of the different grade levels, as well as some different learning apps for the different age groups. I know there's a lot there. You can't jot it down instantaneously, but you will be able to find it at SiouxlandProud.com later tonight, as well as those are posted on the school district's website. City Manager Padmore, I want to come back to you. You have people on the front line of this outbreak when you talk about first responders or fire officials, police officials. Can you talk a little bit about that? We've been lucky, I think, in that sense that we haven't had great numbers of calls even of, you know, I think I have it, come help me. But what is happening locally with those people that are on the front line?
We've done a great job of preparing for instances like this. Just as an example, if you were to call for any reason to call our 911, there is a set of questions that they will ask, which will help us determine how best to address your situation. If the questions resulted in some concern that you might have COVID-19, we will send our fire department there. A individual will approach you first with full protective gear to ascertain, you know, more of the situation, and then they will act accordingly. The safety of our firefighters, police officers, and other public safety is paramount to me and our organization and our city council. So they've done a great job of preparing. They don't have the luxury a lot of times of social distancing. They have to be there.
Sure.
They have to address the situation. On the side of our police, they are very vigilant about what's going on around them and maintaining you know, appropriate distance when needed. But there are some times that they have to get very involved, and they do their best to limit that.
I think it's important to reference what you just said there too. So if someone happens to see a fire truck arrive and someone gets out and they have a mask, a cover, and it doesn't mean that there's someone that they need to be fearful of the community. No. It means that you're taking precautions.
Yes, we're taking, based on the questions, we take everything very seriously. We couldn't afford to have our fire department be exposed to it where it would spread throughout a fire station or throughout the whole department. So we take it very cautiously and we act accordingly. And that's not to say you won't see a fire truck then pull up. They haven't they haven't answered the questions in a way that would cause any fear. So you would see you would see them in their normal attire going in to assist.
Right, something to keep.
And law enforcement in the city as well as in the county, they also have the personal protective equipment with them in their vehicles. So if they did come to a situation, they would be able to protect themselves as well.
Important. And as we've talked about, the communication is greatly important at this time. I want to take just a minute to take a break here and listen to comments made by the governors from all three of our Siouxland states earlier today, beginning with Iowa Governor Kim Reynolds, who highlighted the importance of that communication across our state.
When we have the same criteria and we're consistent in what we're basing our decisions on, that helps mayors, that helps communities, that helps our healthcare partners. It helps us all feel confident as much as we can be with a very fluid situation in making the decisions and the recommendations that we are moving forward.
If you are a traveler and you have been traveling internationally to places where we know there are high incidences of coronavirus, places like Europe or Asia, when you return back to Nebraska, you need to quarantine yourself for 14 days. If you're a domestic traveler, Places like Denver, Kansas City, Chicago, places that are going to be closer. You need to quarantine yourself for 14 days.
Remember that any changes that we make for how we conduct our daily lives has to be sustained. This situation is not going to be over in a week. Projections are, and models and data and facts tell us that we have another 8 weeks potentially until we see our peak infection rate.
Rebecca, I want to come to you after that comment from South Dakota Governor Kristi Noem. She's talking about 8 weeks that we'll continue to see an infection rate. Is that what, as you see it with your folks as well?
Honestly, we're more pushing the message of the social distancing, along with, Governor Reynolds, of stay home if you don't need to go out. If you do need to go out, instead of going to the grocery store for your daily needs, try to plan out, a week long. We do know businesses are restocking. It kind of seems like that initial surge is over, so the stocks are and the shelves are replenished. So just making a few key changes for a short term is actually going to be more beneficial in the long term.
We have seen a great work from our business community, as well as restaurants and bars and others have been asked to close their inside services, but Siouxlanders still taking advantage of those drive-up and other type options. I know there's been a couple that actually ran out of food stock because they were so busy still, so that is a good sign. Bob, talk just a little bit maybe about the economic development side. The economy is at the center of this, as well as the health side of the issue.
With the requests of restaurants and other businesses that we know that have been requested to close, we know that puts a financial hardship on our community and our businesses in our community. The state has helped. They've rolled out some programs. The federal government's in the process of rolling out some programs to help those distressed businesses. We'd like to direct people to our LocateSiouxCity.com website. As we become aware of grant programs, we will place them on our website, but we'd also encourage them to reach out to our Economic Development Department. As they need help, we will help weed them through the proper channels to get them where they need to be and to help them get what they need to get.
I want to talk about precautions that are going on in the interim, both with the schools and in the city and the county. Are you able to take advantage of this period with no one in your buildings, Dr. Gosman, to do that deep cleaning and to work your way through that process? And likewise with facilities, I know we've seen in some locations where there's been spraying in buses or in we don't have mass transit on rails here, but in that case, or even in some particular buildings. So I want to ask both of you about those. Are we getting that done at this point?
Yeah, we learned that we were going to close our schools at 8:30 on a Sunday night, and we needed to get that information out on your 10 o'clock news cycle, and the media has been really good partners with us on that. But I just want to say how proud I am of the staff members in the district, our food service staff, our building engineer staff, our transportation staff, our school board, and the great decisions they've been able to make quickly, and the decisions that they've made to keep employing our staff so that we can get them in our buildings. We've got over 2.5 million square feet of space in the schools, and I'm pleased to report that all 2.5 million and more are going to be cleaned, very deep clean, while we're closed down for this time period. We have about 70 school buses. Those are also receiving a very deep cleaning as we do this work. And it really has not only just been those internal people I mentioned, but outside agencies have contacted us to volunteer to bring people over to help out as well. The Chamber has been such a great partner to us and helping us think through how this will impact the business community and how we can get the message out. So there are a lot of people, and it's just like Siouxland to come together. Right. Whether it's a plane crash or a flood or whatever it might be in history, Siouxland always rises to the challenge, and this is another example.
Rebecca, might we see deep cleaning in facilities or
You're seeing them throughout the facilities, even, county facilities that still have to operate like the jail. They're taking additional measures, not only with the law enforcement officials, but with the inmates as well, making sure none of that spreads or as an inmate comes in. The county courthouses have gone to as much of an appointment only as possible, and taking full advantage of doing that and be able to clean surfaces and doing that deep cleaning. The most recent change was the treasurer's office did go to the appointment only, so we're not going to have that long wait or those folks sitting in that lobby area.
Bob, one of the early concerns was our sewer system, our water and sewer system here in the community. Are you seeing that people are understanding that just because we're using sanitary wipes to do counters, those things can't go into our sewer system? Is that still a concern?
It kind of is a unique outcropping of COVID-19, but as people have started to use the disposable wipes, we've reminded them that while they say they're flushable, they should not go into our sewer system. It just increases treatment costs and the likelihood that there could be a problem in the line along the way. From a water standpoint, you know, our water is safe. It will be safe. We have every faith that we will be able to provide all those services and have no concerns from that area.
We've got about a minute until we have to wrap up. Why don't each of you just to take one last second for a closing comment if you'd like to. Rebecca, go ahead.
I guess I'm just going to push the social distancing again. Stay home if you can, you know, making sure you're washing your hands, covering your coughs, just the basic common respiratory etiquette, I guess is the new word that they're saying, so just passing that along.
So many of the other problems won't become problems if we just do the simple things. That's right. Bob?
Just to have patience with not only the school district but the city and our county. We're here for you. Unlike other businesses that close, we will not close. We will be here for you. It might take a little bit longer to get some things done, but we are here to get things done for you.
And I would just say, you know, use the resources that we've made available on the school district's website. We're preparing to open on April 14th at this time, but should it be extended, we'll continue to make more and more resources available. Certainly, we understand the parents and the guardians are the child's first teacher, and so anything they can do to help us with that academic progress while we're on shutdown is most helpful.
I want to remind folks of a couple resources. A new one out just today, coronavirus.iowa.gov. It's like a clearinghouse of anything coronavirus related inside the state of Iowa. And I know there's you were mentioning earlier, a local go-to as far as questions as well, Bob.
Yeah, if you go to our sioux-city.org, we have a link for all local information that's being provided through the city. It's district health information, EOC information. We encourage you to go to that site as well.
And making sure they're valid sources. There's a lot of Facebook popping up.
We're out of time right now. We thank everyone for being with us, and we'll continue. Good night.